We are moving from one insightful session to another. Now it's time for the track and trace in Europe. Okay. We will have an look to know the track and trace in IMVU. We will have Mr. Charles Young now, the principal architect at Solidsoft Reply company. Mr. Charles, can you please unmute yourself and start your session?
Back to headset. Can you hear me now?
Yes, yes.
Hello. Good,
yes.
good. Okay, yeah, sorry about that. Let me just work out as well how to share. Where do I share from? Share screen, got it. Okay, so just give me one moment while I sort this out.
Take your time.
That is not the right screen. I can't actually see the tab that I'm meant to share within the sharing thing. I'm clearly struggling with the technology today. So just bear, bear with me.
You can share the slides with me and I can share it, no problem.
Fine, that may be the way to do. When it came up, it didn't come up with the right tab. So again, sorry about this, everyone. Bear with me 1 minute. Presumably there is a chat option here that I can drop the slides into, or just send them to you. Let me have one more go at sharing, because it's rather tedious for people to see all this going on. Let's have a look. So I go into share. It says, oh, hang on a minute. Sorry, entire screen. I've got it. Good. Share that. And if I just now present, sorry, yes, I didn't see the correct option on the share screen. Okay, just while I'm waiting for the presentation to come up properly, he says, there we go. Hopefully you can see that now. Can you see that on the screen?
Yes.
Yes, good, excellent, good. We're away, fantastic. Okay, well, let me just say again, thank you very much to Mr. Ahmed for the invitation to come and speak here. It's really well appreciated and an honor and privilege to come and speak at the event today. My name is Charles Young. I am a principal architect at a company called Solidsoft Reply. We're a UK-based company with a lot of involvement over the years in medicine verification and traceability, increasingly with what we're doing. So for us, that's the European Medicines Verification System that I'll speak about today, and also the trust system, which Grant Courtney will be talking about in a short while. So I'll move on because we've got limited time and talk about the European system, the EMVS, the European Medicines Verification System, which, contrary to what many people expect, is a model that was not really imposed by the European Union. The European Union in 2011 signed a piece of law, a piece of legislation called the Falsified Medicines Directive, which called for a system, but the model is a stakeholder model. It's an industry model that was developed in response to that legislative requirement. And it's a model that is really based primarily on the idea of verification of medicines at the point of dispense. So on the right-hand side of this diagram, there's a pharmacist. Pharmacists by law are required to inspect each pack of prescription medicine, check the safety features, anti-tamper or tamper evidence seal, and to scan a barcode with information in it, which is then checked against records in a trusted repository. And that's by law. And as well as verifying, they're also required to decommission packs when they supply them to the public or in one or two other situations. So that's the main focus. Within the supply chain, verification is largely voluntary in most cases. It doesn't have to be done. Wholesalers can do it, or other supply chain operators, but it's not required by law, except in certain high-risk scenarios. So there are certain situations where wholesalers must verify. And if they decommission a pack, for example, they destroy it or they export it beyond the EU, or one or two other situations, even quarantine, then they're required, and it's mandatory for them to record that state change within the system. So that's essentially the idea. And of course, everything hangs on the trustworthiness of the repository at the center of this. Okay, so I barely need to speak about this now because we've seen these GS1 standards talked about already from a couple of speakers, but each prescription pack in the European Union is serialized. Almost all packs using GS1 standards. There is an exception for historical reasons for certain packs in Germany, but otherwise all packs use GS1 standards, the GTIN, serial number, the batch or lots identifier, and the expiry date. We've seen that already in Ethiopia just now, and also optionally a national healthcare reimbursement number, another GS1 standardized approach, which is only used in a handful of countries. The barcodes are data matrix barcodes, not QR codes. And that's really because data matrix barcodes are a bit more compact and generally a bit more reliable, a bit better suited for this purpose. So explaining the MVS, probably a good place to start is just some of the statistics to give an idea of the size of the system. So currently it protects more than 460 million citizens who across Europe, and those who are obviously have been prescribed medicines. It's used in 31 markets, identified in terms of separate regulatory authorities and legislative jurisdictions. We support 1,200 plus manufacturing partners, 2,900 marketing authorization holders, another statistic around about 1,800 or more now participation agreement signers, OBPs they're called in Europe. And they are global in many cases around the world, placing medicines on the European market. 300,000 plus now separate products or SKUs, so GTINs, essentially 8+ billion packs of medicine, which are verified per annum in the European Union. It's mandatory, as we've already said, at 130,000 plus points of dispense, best part of 300 million scans a week. And we've been live officially since February of 2019, although parts of the system have been live continuously since 2014. We provide a single hub, as we will see, and 29 national systems. If you're wondering why there's 31 markets and 29 systems, national systems, it's because in a couple of cases, countries double up and share a system between two countries. Okay, so this slide also just helps with the map as to the geographical use of the system. Essentially, any country that's in any shade of blue, dark blue, light blue, turquoise, is on the system today and using it. Switzerland is strictly a third country, but in union with Liechtenstein, we expect will move to mandatory verification, but currently they use the system on an optional basis. Everyone else, including 3 countries which are in the single market, but not officially part of the European Union, they all use the system for all prescription medicines. And there are other countries which are negotiating to join the EU, so we expect that in time the number of countries will grow further as that actually happens. That's the green Turkey, which is currently in sort of frozen negotiations with the EU. And on the right-hand side of this diagram, this is really the organizations responsible for the ownership and management of the system. And that's mainly a community of national medicine verification organizations. Each one is a not-for-profit stakeholder organization. It's not a government agency. Members of the board are drawn typically from pharmaceutical industry representative groups at a national level. And there's also at the European level, the European Medicines Verification Organization, which works with European-wide industry representative groups. And they also work with both EMA, the European Medicines Agency, and at a national level with what Europe calls national competent authorities, but everyone else would call a medicine regulatory authority. So the system is not a single technical system. It's a distributed system centered on the European hub. The European hub then is owned by EMVO, and Envo manages the participation of manufacturers and parallel distributors as well, and they connect their systems directly to the European hub and upload data, as we will see. And the European hub then interfaces with each of the 29 national systems, and those national systems are largely blueprint, apart from one. They're all blueprint systems. They were built specifically for FMD, and sort of their functionality is validated by Envo. And those systems are the systems owned by the NMVOs, National Medicines Verification Organizations, and they manage the participation of each wholesaler and pharmacist and hospital, and in some cases dispensing doctors who connect to those national systems, which gives the EMVS this main data flow on this diagram. The manufacturers maintain master data on the system, product names, form strength, dosage, marketing authorization information, various things like that. But they upload the equivalent of instance lot master data, commissioning events type data, to the system. We call it product pack data, and that's the batch numbers and the batch numbers and serial numbers for finished product. And also in Europe, parallel distribution is legal and highly regulated, which is not always the case in other parts of the world. And so they're on the system as well, because if they repackage, if they break down original packs and repackage the doses, they must also upload similar data and go through one or two additional checks as well. And then the hub distributes that data, master data, pack data, etc., based on marketing authorization. So it goes out to the national systems, subsets of that data to the national systems. Then across Europe, we've got all our hospitals and community pharmacies, dispensing doctors, and the wholesalers, and they connect the relevant national system for the purpose of verification and decommissioning of those packs. So that's the flow within the European system and how the MVS kind of works. So let me finish off with a couple of slides. Firstly, just the operations for national systems, really four main types of operation. They are all verifications, so everything is really a verification, but you can just verify. If you're a pharmacist or a wholesaler, you can just scan a pack and verify it, in which case the system reports back one of these reported states for that particular and unique pack. So if it's active, it could be supplied to a member of the public, otherwise it could be one of the other states. They can scan a pack, that is a verification, but it also moves the state recorded in the system to supplied, because it's been supplied to a member of the public. There are other forms of decommissioning, which pharmacists can do to a limited extent, wholesalers to a greater extent. Then there are some other states as well, which arise if the pack expires or if it's recalled or various things like that. And there's also a facility which in certain cases, under very strict rules, a decommissioned pack can be reactivated, because that is something which occasionally needs to happen. So there is that part as well. And we also support bulk as well as that. But let me finish off with just talking about alerts, because that's a major part of the system. If the system detects a falsified medicine, sorry, a potentially falsified medicine, then there are alerts. Those alerts are often part of a return process. There are reports that are available to national competent authorities, to the NMVO, and electronic notifications return to the manufacturer, who are allowed to see a very restricted view of just what happened with that one pack to get an idea of what actually happened. So I'll finish off with just this slide here. I'm not going to go through it. Hopefully we can share the slides and you can read it. These are just the summary of the legal obligations of various actors. But what I wanted just to pull out from this at the bottom left-hand corner is the data in the system, which is jealously guarded from the point of view of its use. It can only be used for purposes stated in law. It cannot be used for commercial advantage, for example. So NCAs have the widest, these are the medicine regulatory authorities. They can use the data in the system for a wider range of purposes, including reimbursement, pharmacovigilance, pharmacoepidemiology, and there's further changes to the law which will open that up additionally for national and European-wide use of data for shortage detection, for example, and that's coming down the line. Okay, so I hope at a breakneck speed that gives an idea of the MVS. And so, yeah, question and answer.
Thank you. No, that was great. Thanks, Charles. I mean, moving obviously from Egypt to Algeria to Ethiopia and then to Europe, one clear distinction is obviously the level of maturity you guys have, having operated live for 7 years. There is also another distinction that those other previous markets, traceability markets, whereas Europe is a verification model. In terms of the experience and everything that's been learned and what you've outlined, what would you provide as advice, tips, or help to emerging markets like the ones we've just spoken to that they consider in part of their roadmap?
Yeah, that is a great question, and one that Grant may want to speak to with regards to trust, because of course the trust system is envisaged and built to act as a catalyst for change within low and middle income countries and emerging markets. I think the general things, it's a difficult thing because the things which really make a difference in Europe is the legislation, the mandatory scanning, the existing protections that are already in place. This system is judged by the lack of falsified medicines that it discovers, not by the number, because it's a final chance to catch anything that slipped through all kinds of other nets. So the best number is 0. We haven't quite managed to achieve that, but that's what we're actually looking for. It's a weird way of thinking. But I would say that the most important things are not, especially with verification, is, you know, you can get systems up and running fairly quickly and out there if you don't try to get too ambitious about every aspect of track and trace. Track and trace is complex and can take years to fall into place. Europe could really do, in my view, my personal opinion, we're thinking more about track and trace in its system, and that may happen eventually. But its genius was to get this system up and running in a complex environment really quite quickly, over just a couple of years, because it concentrated on what was most important, which was the protection of patients. So I would say keep it simple and think carefully about, you know, if things are not mandatory and this and that or whatever, think carefully about how that then interacts with law, legislation, regulation, existing systems, existing practices and processes.
Brilliant. Thank you for contributing to this community, Charles. Really appreciate that.
I like the question, Justin, and I like, of course, the great session of Mr. Charles. It was very informative. I have a discussion with Justin from a years ago. The discussion started with that I have a Middle East and African experience in track and trace, and Justin have the other side in Europe and America experience. Sharing the experience together make more knowledge, give more insights that the track and trace always are not the same. The track and trace are different experience from different markets. Not all the market will, every market will implement the track and trace or copy the other market track and trace. Every market have its own perspective, have its own idea to implement the track and trace, have its own objective. Maybe some markets needs to implement the track and trace to have like insights for the stocks inside or something like this. So this is the value of the discussions. I don't know this because I didn't start discussions yet with Justin. This is the value of what we do today. We have a different experience from different countries, from different markets. We see what Algeria and Ethiopia did, and now we see the experience of Envo, as Justin said, around 7 years now. By the way, I'm very big fan for the alert management system. I like the alert management system. For Envo, it's amazing. It's amazing and very, very detailed. So this is what inspired me. Thank you very much, Mr. Charles, for this very detailed and I like the countries which is imported, so I take a picture for it. So thank you very much for your time and for your invaluable time. I think after Mr. Grant session, I think there is yes.
Sorry, Ahmed.
We can have like a contribution together, because trust and Envo have some similarities in this. Mr. Odette, I think you have a question.
Yes, thanks, Ahmed. Hi, Justin. Charles, great session. Thank you so much. Insightful. This is Udit Singh from ACG. While European Union has widely relied upon just the component of serialization, do you think the initiative towards bringing in an aggregated package, which is the parent relationship, will be there in the nearest vicinity?
Yeah, but you may not know how sort of timely that that question actually is, in the sense that this is a very active conversation right now within Europe. So I always say, you know, I sat through a meeting back in about 2017 with a bunch of very angry wholesalers who were very angry because there was no aggregation in the European system, no support for it. Now that actually is probably not the main problem, because of the fact that verification is not mandatory in the supply chain, but it is a problem for hospitals in particular, and it does come up in a number of different use cases. So I can't really, you know, there's not a lot I can say about what will happen in Europe, because it's very much active discussion, but no decisions or timescales. So, and I don't know how this will work out. But there is, we know, a lot of interest from the stakeholders in introducing forms of aggregation. And I'm stealing from Grant when I say that, because he was saying this to us just the other day, that it's unlikely that that will mean in the foreseeable future a wholesale move to track and trace. We don't think that's likely to happen. But I do think it's quite likely that aggregation will be introduced, and I think it will be very helpful in some scenarios, particularly in hospitals, which could be quite mechanized and automated and run into problems, and in certain scenarios within the supply chain. So aggregation, I think, will arrive, and it will certainly nudge the system more towards a traceability view of the world, but not necessarily mean that traceability will, you know, be taken on wholesale.
Sounds good.
Okay,
Yeah, this has been something that's been coming up in the supply chain discussions across, whether it is India supplying to Europe or anyone trying to receive the products in Europe. I think it's going to be a value add if aggregation happens to the supply chain, especially, rather than having multiple events and identifying a lot of issues. Later on, it can be prevented in the very initial stages. But looking forward to that happening, actually.
Yes, absolutely. And I think the point there is just to say that the system, very wisely for the European market, did not try to be a traceability system, coming back to the point that was made that each country has its own landscape, its own story, its own challenges. But I do think there's a natural progress or journey. We've seen it in Turkey. There's a natural journey towards greater and greater support for aspects of traceability with these kinds of systems.
Thank you. Thanks, Charles.
Thank you.
Thank you for this great discussion indeed. Of course, I'm very sorry for all the questions, because we have a very, very limited time and a lot of sessions ahead. So, Mr. Haitham, please, can you copy your question in seconds, please? I need to move to the next session, please. If you have a question, can you put it in the chat, please? Okay.
I'm sorry.
No. Sorry,
yeah, it's by mistake.
I mean, sorry, Dr. Haitham, I not mean you. I mean Haitham Al-Tijani. Mr. Haitham Al-Tijani has a question. I think, Mr. Haitham, can you post your question? I need to move to the next session. Can you post your question, please, to ask Mr. Charles before we end the session? Anyway, post your question, please. And I think Mr. Charles can answer your question in the comments. Mr. Charles, thank you very much for your valuable time in today's webinar. It was very, very informative.
Thank you.